Hello, everyone. Welcome to another session on exam focus. Today's topic shall be on pulp. My name is Dr. MAYEEESH, and I'm working in the Department of Oral Pathology, KMCT Dental College, Kozhikode. The basic learning objectives shall include the general features of the pulp, the functions of the pulp, the histology and the zones of the pulp, and finally, we shall discuss about the age changes of the pulp. In this picture, you can appreciate the strategic location of the pulp. The pulp is located inside the tooth and is surrounded by dentine. If you look at the general features of the pulp occupies the center of the tooth. It is a soft ectomesenchymal connective tissue. It is surrounded by dentine on all the sides and is usually referred to as the dentine pulp complex. If you look at the pulp, it's broadly divided into the coronal pulp and the radicular pulp. The crown portion is referred to as the coronal pulp, and the root portion, it is referred to as radicular pulp. If you look at the coronal pulp, the shape resembles that of the crown. It has basically 6 surfaces, mainly occlusal, mesial, distal, buccal, lingual, and the floor. And the extension of these cups into the cusp is basically called as the pulp horns. The number of horns is equal to the number of cusps. If you look at the radicular pulp, it extends from the cervical region of the tooth, that is from the crown to the root apex. It is continuous with the periapical tissues through the apical foramen. The apical foramen is average size is around 0.4 mm in maxillary teeth, whereas in mandibular teeth it's around 0.3 mm. The shape and the location may change due to functional influences. The relocation of the apical foramen is seen tipped and the teeth showing mesial migration. You have also accessory canals. Basically, these are the ones that are seen on the lateral surfaces, or the lateral sides of the radicular pulp. They usually occur in areas where there is a premature loss of root sheath cells. The accessory canal may also occur where the developing root encounters a blood vessel. Again, here we can appreciate the location of the pulp chamber, the accessory canals, the root end openings. And you can also see that the pulp is located in the crown and in the root, basically referred to as the coronal and the radicular pulp. And the pulp is located in the pulp chamber. In deciduous teeth, if you look at it, we call it as the primary pulp organ. It basically functions for a shorter period of time, an average being around 8.3 years. And the pulp aging is faster in the primary pulp organ. Whereas when you come to the permanent pulp organ, the pulp organ with the permanent peaks takes longer time for the formation. It functions for a longer period of time, and the pulp aging is slower. Now, this is a very important question, the function of the pulp. It's asked in the university exam as a 3-mark question. So you need to remember the headings first. So you have basically inductive function, formative, nutritive, protective, defensive, and reparative. So now we shall discuss few points regarding each of these functions. So when you come to the inductive function, it's basically the dental papilla. It determines the crown pattern and differentiation of the amalgam through its inductive influence. So as you know, in the development of teeth, you have the inner enamel epithelium having an organizing influence, ectomesenchymal cells of the dental papilla, thereby differentiating into a odontoblast. So this kind of inductive influence is there through the dental papilla. Next is the formative, whereas the formative is due to the pulpal odontoblast, which we have in the pulp, and they are basically the formative cells of the dentine. And they are also involved in the support, maintenance, and continuous formation of dentine. Another function of the pulp is the nutritive function. The pulp nourishes the dentine through the odontoblast and the processes by means of the rich blood vascular system it has. So it provides nutrition and oxygen to the cells. Here you can appreciate the rich vascular supply of the pulp. Another important function is the protection by tooth by producing a representative or inducing dental sclerosis and thereby preventing the irritating stimulus reaching the pulp. You have a lot of defensive cells. You have macrophages, you have lymphocytes, neutrophils, eosinophils, mast cells. All these cells are the cells which help in defense and the repair of the pulp. The reparative function includes responding to irritation like mechanical, thermal, or bacterial, reparating dentin formation, and calcification of the tubules. If you look at the histology of the pulp, broadly you have the histology being the different zones which you need to write about. So the first zone which we have is the odontoblastic zone. Then you have the cell-free zone, otherwise called as this wheel zone. And then we have the cell-rich zone, and then what we call as the pulp zone. So the zones of the pulp is asked again as a 5-mark question. Sometimes the histology of pulp as such has been asked. In that case, we need to write about the zones. And along with that, we need to explain the cells of the pulp and other components of the pulp in detail. Now here you can appreciate the different zones. You have first is odontoblastic zone. You have the cell-free zone, which is otherwise called as the zone of wheel. Then you have the cell-rich zone, which consists of a lot of these cells which are there, including the fibroblast. And then you have the pulp core. And we'll go one by one into these zones. As the name suggests, odontoblastic zone, they found in the periphery. They're basically your dentin-forming cells. Now, the cell-free zone, you need to write about zone of wheel. Zone of wheel is such as asked as a 3-mark question in your university exam. So you need to know that it is a cell-free zone. It's just below the subodontoblastic zone. It is a space in which the odontoblasts move pulpward towards tooth development or during tooth development. It contains nerve fibers that have lost their myelin sheath, and they're known as the subodontoblastic plexus or the plexus of Rashkov. So plexus of Rashkov is again asked as a short note. So you just need to know about it if they have asked this as a 3-mark question. That's the cell-free zone. We see it adjacent to the pulp core. It has a lot of cells. The predominant cell type which we see in the pulp is a fibroblast. So you have a lot of fibroblasts and you have other types, including the undifferentiated mesenchymal cells. So here you can appreciate the different zones which are there. The odontoblastic zone, the cell-free zone, cell-rich zone, and the pulp core. When we look at the contents of the pulp, you need to know about the cells, the matrix, the vasculature, the lymphatics and nerves. Along with that, we need to know about different cells, like what are each cells that are there. So when we look at the cells, we have the odontoblast, we have fibroblast, we have undifferentiated mesenchymal cells, and we have defense cells. Then in the matrix, we have fibers, we have ground substance. Then as we discussed earlier, vasculature, lymphatics, and nerves. Now, we go into each of them. They are found in the periphery of the pulp. They are adjacent to the pre-dentin, which is basically the cell bodies in the pulp, the process in the dental tubule. The length of it is around 25 to 40 micrometer and diameter being around 6 to 7 micrometer. So how does the odontoblast, they are basically a tall columna in the crown, in the cuboidal in the middle of the root, and around ovoid in the apex of the root. So how does it appear? You have a large oval nucleus which is filling the basal part of the cell. And you have a lot of these organelles, mainly the RERs, the Golgi apparatus, mitochondria, and vesicles. So when you look at it as an odontoblast, how would you come to know? You look at the cytoplasm, it has a lot of synthetic organelles. You call it as an active cell. Then you have an intermediate type where you have less organelles, and then you have the stubby cell, which is basically a resting odontoblast, which basically has a closed face nucleus. So here you can appreciate the odontoblast in the layer of, we can appreciate that, how the odontoblasts are. Next, when we come to the fibroblast, we know the fibroblast is the most numerous cell type in the pulp. So one of the questions they ask in the exam on the Viva especially is that, which is the most predominant cell that you see in the pulp, and it is the fibroblast. The fibroblast has a dual function, collagen fiber production. Along with that, it also degrades collagen. So you don't have a fibroblast itself, you have a fibroblast. So it has a dual function. It produces collagen and also degrades collagen. It's basically stellate shape. It possesses processes showing intercellular junctions. And of course, if it's an actively synthesizing fiber, you have a lot of rough endoplasmic reticulum, mitochondria and all will be present in the cytoplasm. In the younger pulp, you see more of this. So because of active synthesis, older pulp, it's going to reduce. It's going to decrease in age. And as I discussed earlier, dual function of the fibroblast. Undifferentiated mesenchymal cells, very important. Pulp is a rich source of undifferentiated mesenchymal cells. They're found in the cell-rich zone, polynuclear shape, seen in young pulp, and you're going to have a decrease of all these cells as you grow older. So what are these cells? These are basically totipotent cells, stem cells. As a need arises, they can differentiate into a adendoblast, a fibroblast, or a macrophage. You have a lot of different cells, macrophages, histiocytes, mast cells, plasma cells, neutrophils, basophils, eosinophils, monocytes. These are all different cells that are present inside the pulp. So basically, a macrophage, we look at it one by one. It's irregular shaped cells. It has short, blunt processes. Basic function is phagocytosis. So that is what you need to know about macrophages, which we've learned before. Plasma cells, as you know, they're chronic inflammatory cells, and they're helping the production of antibodies. Mast cells, again, inflammatory cells, they have these granules that are present around nucleus, granules, and they are also present in the pulp. When we look at the matrix as such, what we call it as the ground substance, we have the mucopolysaccharides and the protein polysaccharides, which is basically the glycosaminoglycans and the proteoglycans. So basically, they are the basic foundation, that is, they're helping the support system, and they act as a medium for transport of the nutrients from the blood vessels to the cells, as well as the transport of metabolites from the cells to the vessels. Fibers, as we discussed before, the predominance is collagen fibers, mainly type 1 and type 3. And you're going to have diffuse bundles. Depending on the appearance, they prepare either diffuse or bundles. Blood vessels, the pulp is extensively vascularized. And it has, pulp is basically supplied by the superior and inferior alveolar arteries. So here you can see the nourished pulp, which is giving life to the tooth. It's richly vascularized. So the blood vessels, they enter through the apical foramen or the accessory foramen. And we have something called nutrient canals that house the interdental, the interradicular arteries, veins, lymph vessels. And these perforating canals are called as canals of Zircondel and Hirschfeld. So again, this is again asked as a short note, probably as a viva question. You just need to remember that these are basically nutrient canals. Again, rich venous system in the pulp. The vessels exit through the apical foramen on to the accessory foramen. So we have a rich venous system. So here you have this, and you can see the vascularized nature of the pulp, the venous system, the arteries, all these things can be appreciated from this diagram. Lymphatics, again, thin lymph vessels, basically there with irregular lumen, composed of endothelial cells surrounded by incomplete layer of smooth muscle cells. The lymph vessels, they drain the anterior teeth, pass through the submental lymph nodes, and through the posterior teeth, they pass through submandibular and deep cervical lymph nodes. Based on the location, you're going to see the lymphatics. The nerves, the majority of the nerves that enter the pulp are non-myelinated. Many of these gain a myelin sheath later in life. The non-myelinated nerves are found in close association with the blood vessels of the pulp, and many are sympathetic in nature. So you have the nerve endings, basically the nerve axons, which pass from the parietal zone. They pass through cell-rich and cell-free zones. They terminate to the adjacent adenoblastic process of the pulp. So you just need to know that most of the nerve endings located along the adenoblasts are believed to be sensory receptors. So you can appreciate the nerves that are there, pulp. Now, one very important question which they ask, again, is a 5-mark question, is the age changes of the pulp. So first you need to know the headings of the age changes. So you have, first one is what happens. You have decrease in size. So size decreases because you have secondary dentin deposition taking place. So there's a decrease in size. Again, there's a reduction in vascularity as you grow older. The pulp is going to be less vascularized. So that's going to happen. The number of cells are going to decrease with age as in the pulp. There's a loss and degeneration of myelinated and unmyelinated axons. There's a reduction in sensitivity as you grow older because there's nerve degeneration. Again, all the repair capacity as you grow older, the pulp repair capacity is eventually going to get reduced. And then you have what is called as pulpal calcifications that are going to happen. Again, fibrosis, very common feature in aging pulp, which happens because then you have bundles of collagen fibers that appear. And along with that, you have local fibrosis that could happen, resulting in scarring effect. Now, another important thing which you need to remember is pulp stones. So pulp stones is again asked as a short note, and they can ask you pulp stones as another name for the pulp stones is called denticles. So it's basically a synonym. So this could be asked as a 3-mark question. So what you need to remember is that when they ask you 8 inches, you need to write all these points which we discussed previously. And along with that, you need to also write about pulp stones. So what are pulp stones? Pulp stones are basically calcified masses that are present in the root portions of the pulp coronal and root portions of the pulp organ. So basically, you need to know the classification. Headings are extremely important. So you have true, false, and diffused. Yes, true, false, diffuse. Then along with that, as per location, you have classified into free, attached, and embedded. So the pulp stones that appear close, they're basically appearing close to the blood vessels and nerve trunks. Okay. So just remember the classification: true, false, diffuse, and then as per location, it's free, attached, and embedded. Now, what are true pulp stones? True pulp stones, they exhibit dental tubules. They are rare. They're located close to the apical foramen. They're believed to be caused by the inclusion of remnants of the epithelial root sheet within the pulp. So the true pulp stones exhibit dental tubules, whereas false pulp stones appears as concentric layers of calcified tissue. These calcified stones appear within the bundles of collagen fibers. They are calcification thrombi or phlebitis may be seen. They first begin as small nodules and but slowly increase in size by incremental growth. Then you have irregular classifications, what is called as diffuse calcifications on the pulpal tissue. The orientation is usually parallel in nerve fibers and usually seen in the root canal. Now, what is the other types we have? I said only based on location, we have free, attached, and embedded. So when you come to free, they have free denticles are usually entirely surrounded by the pulp tissue. And all pulp stones, they begin as free pulp stones. And you have attached, they partially fused with dentine. That is what's called as attached. And then embedded is the one which is completely surrounded by dentine. So basically, as per location, you have free, you have attached, and you have embedded. So here you can locate, you can see if the pulp stones having clinical relevance in terms of, during root canals and all, you have pulp stones will obstruct the treatment. So pulp stones is again clinically plays important role. So what are the other clinical considerations you need to know? You just need to know something about pulpitis. It's basically inflammation of the pulp, which you'll be learning when you come to your 3rd year. You can check pulp vitality by using heat tests, cold tests, and other things, vitalometers and all that. So this we will be learning, you'll be going into detail more when you come to your 3rd year. So what is the summary? What do you need to know about pulp? It's a very small chapter. It's a very easy chapter as such. You can easily score marks. So you just need to know what is pulp. Basically, it's a connective tissue. It's asked as a frequent viva question. You just need to know what it is. Basic functions of pulp is asked as a 3-mark question. Just go through the headings, write few points about each of those functions. Another thing is the zones of the pulp. The zones, very, very important. Histology is asked as a 5-mark question. So just write each of them, separate. Draw a diagram, neat label diagram, and that's more about it. And age changes, you need to write about the different points. That is what happens to the cells, what happened to the sensitivity, all these things you need to mention. Along with that, you have to remember, you have to mention about the denticles of pulp stones if they ask you about age changes. So with this, we come to the end of this session. I hope this session has been useful to all of you. I thank the organizing committee, especially Dr. Deepu George Matthew, to give me an opportunity to share my inputs on this topic. Thank you very much.